Welcome to AirSculpt TV. It's 4 o'clock on Thursday, and we've got a great show for you. First thing I want to do is, last week we did what's called buffalo hump, which is the back of the neck. A lot of patients think that they just have bad posture, or it's one of their cervical discs that's popping out, when in reality, the majority of the time, it's actually just a fat pad that's typically hormonally based and usually hereditary as well. So this is called, some people call this cervicodorsal hump, some people just call it buffalo hump. So we did her last week on AirSculpt TV, and here's her before, 1 week before and after. And again, show me any technology where they're going to show you the difference in 1 week. No one will except us. So here's before, here's after. Notice the smooth and natural contour, no hump. And obviously our patient's overjoyed, and so are we to show that. So it's the first time we've ever shown buffalo hump, and it's such an important area. It makes so much difference in someone's self-confidence. No one wants to feel like they're hunched over, and they find it very unsightly if they have a low back dress, etc. And it's so easy to fix. The whole procedure took about 8 minutes. So I'm just honored to show you this 1 week before and after. And that's not what we're doing today, though. That's just what we did last week. Today, we are going to do something that's really important, which is almost half of our AirSculpt patients have had some form of body contouring before. And our patient that we're going to see today had her tummy done. Let's show her picture. So she had her tummy done, her abdomen and waist, or what some people like to call Lipo 360 done. In a traditional way. I think it was done with a smart lipo, so-called, which is just traditional lipo using a laser. But what you'll see is, first of all, I'm not even sure which one's before. Lauren, which is it before this one?
This is before.
This one?
Yes.
Okay. So the fact that I don't even know which is before and which is after tells everything. So she had, this is her before, which I think actually looks kind of better than her after, but so she was really unhappy with the result, and she came to us, and we're going to fix it today and do what we like to call revision AirSculpt, which just means we're fixing her body contouring work she had elsewhere. So many of our patients have had, there's so many technologies out there, as I'm sure you all know, and I would say that it's very rare that those patients are happy. And so a lot of our patients, maybe even half, have had something done before that they need us to fix. So she had her tummy and waist done. This is before and this is after. Obviously not a dramatic difference. And we're here to make it dramatic, and we'll show you in a week just how dramatic it is. So we're going to go live with her in Beverly Hills, and we're going to fix it. So without further ado, let's do it.
One moment.
Hi, Dr. Rollins.
Hey, how you doing?
I'm doing great. How are you?
I'm great, thank you. Nice to see you.
Nice seeing you. Okay, so I'm going to just get right into it. We have a very special patient here. Her name is Sarah. She is going, let me just introduce her now. Hello.
I want to meet Sarah.
There you are.
Okay, well, let me see her face. Hi, Sarah.
Hi, Dr. Rollins. How are you?
Good. How are you? Can we
I'm doing
position so we
great.
can like see her eyes? I don't want you to look like Darth Vader.
Sorry. Here you go.
Let's get the camera so we can like actually see her eyes. Okay, good.
Hi.
So,
Let me angle this better for you.
all right. So I hear we're doing your waist and hips and fixing it. Tell me
Yes.
about that.
So about like a year ago, I went to Sono Bella, and what's it called? I was promised something completely different than what I got, and I was really unhappy with my results. So that's what brings me in today, and I really just want my dream body before Hot Girl Summer.
I want you to do. And I'm going to make sure you get it. So
Yes.
are they doing your waist right now?
Yes.
Okay. Before we show that, I want to ask you a couple of questions.
Of course.
How does it feel compared to what you had done before?
Well, this is like completely different because traditional lipo, you're not awake. And here I can talk to them and I can see what's kind of going on, and I'm being reassured. So I feel very, very comfortable.
How painful is it compared to what you had before?
Uh, Night and day. It's very, very different. I don't feel pain. It's like a vibration, and I get like ticklish.
Good. Okay.
Yeah.
Um, let's show what's being done. Okay. Just so
Yeah,
you know,
sure.
Sarah,
Okay.
when we fix someone else's work, AirSculpt actually hurts more and is a much more difficult experience. The fact that you're saying it's night and day is everything to me. So, um, how's it going, Dr. Konevsky?
Doing great, Dr. Ron. Good to see you. Hello from Beverly Hills.
How's your scar tissue?
You know, so one thing is there's definitely, I can feel that scar tissue. Part of the technique that we have is just to really work through and break it up and make sure that we get all that extra fat and scar tissue that was removed the first time around. And
Okay.
really symmetry is what we're going after.
Okay. And can we see her fat bucket? Did you guys just start?
No, we've got some fat already collected.
Let's take a look at what's in the bucket. I need a bucket view.
So this is going to be the fat that we have removed so
And
far.
then, oh,
Oh, wow.
jeez.
Yeah.
Sarah, you were packing it in. I had no idea.
She's petite, but she had it there.
Wow. Okay, so guys, that's just waist fat, and she had already had a procedure done, and that's like, what is that, 1.5 liters or 2 liters?
What is
A
that?
liter?
So 1.2 liters.
1.2.
1.2 liters. Is that just the one side?
Yeah, we just finished the first side. Now we're starting on the opposite side.
Okay. This is epic. You are going to have such a good result, Sarah. This is going to make your butt look better this summer. You're going to have a snatched waist. It's going to be all the difference in the world. So I cannot wait to show your result next week and show a dramatic change. This is
Yeah, I'm
marvelous.
really excited.
I am too. I'm excited for you. I can't wait to see this picture. We might actually want to interview you so we can compare what what it was like after your procedure compared to what you had before as well. So, yeah, if you're willing to do that, we might want to do that.
Yeah, we can
Now,
do that.
okay, cool. What kind of music are you listening to? Because that's a really important question on
We're
our show.
listening to house party music because it's one of the nurses' birthdays. So happy birthday, Unea!
I love that. Okay, good, good. So that's very appropriate. I'm happy. And so you say that it's night and day. Like, does it hurt as much as the dentist? What would you say it hurts as much as?
I'm sorry, I couldn't hear you. Can you repeat that?
Well, how much does it hurt, would you say? What would you compare it to?
You know, like when you like that little tingly of a electric toothbrush.
An electric toothbrush. It's funny because
Yeah.
that's what really inspired this procedure. Yeah. So that's good to know. I love that. So, and you say it hurts a lot less than what you had done before, huh?
A lot less. Yeah.
I'm so happy to hear that. When I look inside your bucket and I see that there's basically no blood at all, it means that Aeroscope is working, because what it's doing is just taking your fat cells and not scraping flesh out of your body. And that's everything here.
Yeah.
Because if that's why we're not hurting you. We're just plucking little fat cells out of your body like berries off a bush, instead of taking a cheese grater or a chisel to your flesh and damaging everything and removing muscle and blood vessels with it. So that's why we have such a beautiful pure fat container that you've got to take a picture with after this.
I am. I'm excited to see all the fat taken out.
Oh my God, you really, you got a lot out of one side of your waist, so you're going to have a very small, probably the smallest waist you've ever had, actually.
Ooh, I'm excited.
What? You're excited? Good.
Super excited.
Did you see the other side of your waist on the table yet? Did you guys show her?
Yeah, it's very, very different than the other side.
Could you feel a nice dip?
Yeah, I feel like more snatched.
Good.
So it looks really nice. And this is like what I've been wanting, you know?
I'm so happy to hear that. That's the whole point of all this is I want our patients to actually feel a difference the same day. Sure, I want them to like how they look in a week and then even more in a couple months. But feeling something the same day is so important, I think, because it's like you've gotten to this point and here you are, and an instant result is, I think,
Absolutely.
awesome. And would you recommend this to your friends and family?
Yeah, of course. Not even just for like, you know, botched procedures, but just so people, people feel more comfortable and confident. So definitely, I would. I'm probably going to send people over.
Do you think this is better than traditional types of?
1000%. This is so much more different.
Yeah, it
It's
is.
not. I'm not in pain. I feel more comfortable. Everyone here is like literally so wonderful. So
Thank
I'm actually having a good time.
I'm so happy to hear that. You know, it's really important for our patients to understand that this is not liposuction. This is not they don't know about this. That's why we do this show, is that people don't realize what we're doing here is really epic and game changing. And it's so different than other
Yeah,
techniques.
it's like really next level.
It is next level. Thank you. I guess that's all we have. I just can't wait to see your result next week. We're going to answer questions now that our followers have asked us about revision work, which means fixing other people's work. So we're going to answer the questions, and we'll leave you to your music. And thank you, Sarah. And I hope to talk to you soon.
Thank you, Dr. Rollins.
Bye,
Have a
Dr.
great day.
Rollins.
Thanks,
Bye.
Thanks everybody for watching.
Thank you, guys. Okay, so we're going to answer. We've got a lot of questions. One of the things I said during her interview was I asked the surgeon, "How was her scar tissue?" The difference when you've had work done before of any kind of technology is you probably have scar tissue, and scar tissue is much harder to get out than fat tissue. Fat tissue flies right out, but scar tissue really takes some special technology to do well. And AirSculpt is uniquely suited to do that because it's so minimally invasive yet so powerful that, of course, it takes fat out very easily, but it's incredibly good to remove scar tissue with and to smooth out lumps and bumps from other procedures, to fix hard spots, which are probably scar tissue, to even things out from one side to the other, because it's so powerful and we have such precise control over what it's doing. So Lauren's going to ask me some questions related to all this. So go ahead, Lauren.
How soon do I need to wait after my original procedure before getting a revision?
Great question. So we get that a lot. Is we have people who get a procedure done and they kind of know right away it wasn't what they expected or what they wanted. Kind of like I've had haircuts before where I get the haircut and I'm like, this didn't work out too well, and now I need a revision. But you know right when you get out of the chair, and it's the same thing. So it's not that hard to know that this wasn't what you wanted, and we really like people to wait at the minimum 3 months because you have to have some degree of healing, and we have to see what we're working with, and we don't know at least for 3 months. Sometimes we ask for 6 months depending on what's going on, but a small, easy area, 3 months is fine.
Okay. What areas can I get corrective AirSculpt on?
You can get corrective AirSculpt on any area of the body from your ankles all the way to your chin.
Can I get revision AirSculpt more than once if I need a significant correction?
So you won't need revision AirSculpt more than once. So if you do need AirSculpt, like some people have their whole body done somewhere, they're not happy and they come to us to fix it. And that you would require multiple sessions because we only do a certain number of areas, around 3 or 4 areas in a given day. So we would probably do a few areas, then have you come back in 48 hours or 1 week to finish the job.
If I have undesired lumps, can AirSculpt smooth out the surface?
One of the great things about AirSculpt is, and one of its unique benefits is it's so smooth because it's better than anything a human being can do. It's so powerful. Wherever you point it, it does a perfect job. So you just point it and it smooths it out, and we actually feel with our hand like this. We sometimes wet the surface of the skin so it should feel like glass. And it's kind of like a power sander in a way for lumps and bumps. So it's one of my favorite things to do, actually. It's the most challenging procedures that we do.
Does corrective AirSculpt include only fat removal or can it transfer too?
So if you get corrective AirSculpt, if you had something done somewhere, you weren't happy, you came to us, you get AirSculpt and you want some fat transfer, we can do that.
Can I get corrective AirSculpt that went badly on a fat transfer? Oh, wait, let me just answer that, sorry. Does corrective AirSculpt work on non-liposuction procedures that were botched?
Yes. So we can do corrective Aeroscope on any form of body contouring. If it's an injectable, if it's hot or cold or infrared or anything else, if you've had body contouring and you're not happy with it, we're the right place to go. I mean, really, so many of our patients, almost half of them, have had something done before that we end up fixing. So it's what we do every day, and it's all we do.
Okay. Someone asked, actually, does this allow also a tightening procedure for corrective Aeroscope?
Great question. So yes, if we Aerosculpt you, your skin will tighten. So we've had a lot of patients who've had their tummy done with Smart Lipo or some other technology, you know, just using Smart Lipo generically, like with any kind of liposuction procedure. And they weren't happy with their skin tightness and they had extra fat. So they came to us and AirSculpt tightened their skin very well. So this is not a tummy tuck. This isn't where you go if you want, you know, we're not going to just tighten skin when you have no fat, but if you have fat to take, then we'll AirSculpt you and not only remove the fat, but tighten your skin at the same time.
How long is this swelling after Aerosculpt?
Well, we're showing results at 1 week every week. So, you know, 1 week is not your full result. It's only the tip of the iceberg. So swelling usually lasts up to 3 months, sometimes 6. The more fat removed, the longer it takes to heal. But if we can show results in 1 week, it means most of our patients in a few weeks are very happy. Even though we always tell them this is only the beginning. Some of our amazing results that people say on Instagram, that can't be the same person. It really is. But maybe those people were 6 months out or 3 months out. So after 1 week, it just gets better and better.
Someone asked, how long do you have to wait after giving birth to do this procedure?
After giving birth, if you're not breastfeeding and you had a normal delivery, it's 3 months. If you had a C-section, it's 6 months. And that's it. Thanks for watching today, and I look forward to seeing everyone next week. We're going to be doing inner thigh, knee, and banana roll, and we're going to be doing it at our new La Jolla office in San Diego, so I can't wait to show all of that to everyone. And remember, what's behind me is not AirSculpt. This is before and after traditional liposuction, and we are going to show you next week what we did today and show you a dramatic change. Thank you. Bye-bye.